All right, everybody, welcome to our monthly webinar. This month, we're going to be tackling cardiovascular disease. So if this is your first time, welcome. Every month, I do a free Zoom lecture. So this month, we're doing cardiovascular disease, and we're going to follow it up next month by doing diabetes, because diabetes and cardiovascular disease are kind of like cousins, right? They kind of go hand in hand. So if you like this webinar and you have an interest, sign up for our diabetes, which is going to be the first Wednesday of next month. And then we'll do other topics as we go. In addition, if anybody has an interest in a topic, drop me a note through an email through one of my social media platforms. And if there's enough interest in it, I will put together a talk for it. And in addition, if you have a group you want me to give a talk for about anything specific, you know, like workplace injuries, things like that, just let me know about that as well. All right, let's get started. Let me share my screen. What's this? There we go. All righty, hopefully you guys can see that screen. So when we talk about cardiovascular disease, we're going to be probably breaking some myths that has been perpetuated. So keep an open mind, and let's get started. So I put this slide in here just to prepare people, because you know, most people don't want the truth. They just want a consistent reassurance of what they believe is true. And nowhere is that more evident than in the medical community, which is why we get some myths that just keep getting perpetuated over and over and over again and just seem to never go away. The actual science proves to the contrary, some of these things, and we're going to be talking about these throughout this. Okay, so the things we're going to be talking about are let me just see if I can get that off my screen. Coronary artery disease that can be reversed, cured, and even prevented. Current medical stance is that it cannot be reversed, but there are plenty of documented cases of it being reversed, and we're going to discuss how to do that. We'll also be talking about cholesterol levels and how they are not related to heart disease, and there's plenty of research that proves this. We're going to be discussing statin drugs, probably one of the bigger, if not the biggest drug that's being prescribed in the world today. Okay, the side effects of statin drugs, they're far more common than people believe, and we're going to be discussing some of that. And then we'll also be talking about some of the problems with the statins. Okay. So first, let's give a definition of what cardiovascular disease is. Right? Cardiovascular disease is a type of disease that affects the heart and the blood vessels. Okay, the most common cardiovascular disease is coronary artery disease, okay, which is a narrowing or blockage of arteries. You can have things like chest pain, heart attack, stroke, and other things like congestive heart failure, heart rhythm problems. And we're going to be mostly sticking with arteriosclerosis and atherosclerosis. Okay, so let's define what arteriosclerosis is. It is a thickening or hardening, a loss of the elasticity of the wall of the arteries. This makes a very rigid artery or vascular structure that doesn't expand very well. The process gradually restricts blood flow to organs and tissues and can lead to severe health risks that are brought on by atherosclerosis, which is a form of arteriosclerosis. So atherosclerosis is a disease which plaque builds up inside the arteries. The plaque is made up of fat, cholesterol, and calcium. So it's an important factor, right? Because cholesterol seems to get the bad rap here, but there's a lot more to it than just cholesterol. Calcium, as we'll see, is pretty good indicator that we're having a problem. Other substances found in the blood over time, plaque hardens and narrows the arteries, which limits oxygen to getting to organs and tissues. All right. Next. So some of the risk factors involved are men age 45 years and older, and women 55 years and older. So why is that, right? The main hypothesis of why women tend to get heart disease later is because of menopause is supposed to happen around 55. Right now, it's happening a little bit earlier because there's a lot of what's called xenobiotics and hormone interrupters in our food source. But as women have a menstrual cycle, they lose blood, and when they lose blood, their blood is thinner, which a thick blood is going to be very damaging to the body, which we'll talk about in a bit. There's also family history, smoking, high blood pressure, abnormal levels of blood fats. Okay, now this is the medical definition, which I put in here just to be thorough, but we'll see that there's a caveat to that. Diabetes, inflammation, sedentary lifestyle, and obesity. So when we talk about risk factors, right? Probably the largest study conducted it was by Harvard University, followed 120,000 nurses. It was done in the mid-70s, and they wanted to determine the risk factors for cancer and heart disease. It was published in a journal called New England Journal of Medicine, and they came out with 5 factors, right? And those were smoking, alcohol, engaging in moderate to vigorous exercise for at least a half hour a day, maintaining a healthy weight, and eating wholesome, low glycemic diet with plenty of omega-3 fats. So that's what they found was the 5 best things to do to make sure you don't get heart disease. We're going to discuss some of this. Obviously, smoking, it's a no-brainer, right? You don't even have to, and same thing with alcohol. Those two are pretty much, they do a lot more than just heart disease, from cirrhosis of the liver to cancers. So we don't really need to go into that. We'll talk about vigorous exercise or moderate exercise. Vigorous exercise, we'll see, can actually be detrimental because it causes a stress response, and that can also cause heart disease. And then maintaining a healthy weight, and we'll discuss diet in detail. Okay. When we talk about omega-3s, right, they are consisting of 3 things: EPA, DHA, and alpha-linoleic acid. And we'll see that the EPA will increase your HDL, or what is typically called your good cholesterol, and will be cardioprotective. So what are some early signs and symptoms of cardiovascular disease? Well, if you notice that your gums are bleeding when you floss or brush your teeth, or nosebleeds that don't really have a reason for them, or wounds that are slow to heal, right? Those 3 collectively are usually caused by a lack of vitamin C. And we'll see also later on in the lecture how vitamin C is intimately linked to atherosclerosis. Okay. Also dizziness because of lack of oxygen, shortness of breath after exertion, sweating, rapid pulse, and heart palpitations can all be indicators of cardiovascular disease. So if you don't know what this is the current medical model of how they deal with cardiovascular disease, right? That yellow portion right here on the outside is a plaque buildup. And what happens is they put in what's called angioplasty. It's a balloon that they stick right in the middle there, and they blow it up, and it pushes the fat aside and allows blood to flow through. Now, this can be life-saving, right? If you have a clog right here and you can't get blood to muscles, especially if it's the heart muscle, you get what's called hypoxia, and the tissue starts to die. But what they found was that you put the angioplasty in there, separate it, and guess what happens? It closes back up very quickly. So then they did what's called a stent, and that's where you can see this wire right here, right in the middle of it. That stent is there to hold open the pathway. But there's a problem, right? And that problem is that cardiovascular disease is a systemic disease. It doesn't just happen in one place, right? It's happening all over the body. So you put a stent in one place, and it's just going to show up somewhere else, because it's a lifestyle disease. It's not just like a slip and fall where you get a bruise in one place. You know, it's happening all over. So the other thing that the medical model does is they do a bypass, right? They take a vein from the leg and they stick it in the heart and they just bypass where that clog is, right? You can see the example here on the left. There's a bypass of the inferior artery of the heart. Now, again, all these medical procedures that can save your life if you've gone so far past the part of being able to do it conservatively that you need intervention. But if you rely on a stent or a bypass without changing your lifestyle, you're going to just run down the same road again. You know, it's just sweeping the dirt under the rug, so to speak. So it's got to be a better way, right? So let's discuss cholesterol, since everyone seems to link cholesterol with cardiovascular disease. And, you know, everyone always says, good cholesterol, bad cholesterol, but do we even know what that means? So we're going to see right now that cholesterol is probably one of the most important things that your body produces, right? Yes, your body produces cholesterol. Your liver produces most of your cholesterol. And it's an essential molecule. You know, without it, there's no life. You'd be dead. And here's what it does, right? It serves as many important functions, right? It's makes a part of the cell membrane of every cell, which gives it its structure. And it also acts as an intermediary between what's outside the cell and what's inside the cell. It gives the cell its integrity. It makes vitamin D, and vitamin D is needed for immune system. Okay, your cholesterol also makes a class of hormones called steroid hormones. And it also makes your sex hormones, which are estrogen, progesterone, and testosterone. It's also responsible for synthesizing bile, right? It synthesizes bile, which is needed to digest fats. Okay, and we'll see later how we can use that to lower our cholesterol levels if they do get out of a range that's acceptable. So I mentioned that your liver produces cholesterol. It makes about 1,500 to 2,000 milligrams of new cholesterol a day. And your diet really doesn't have much to say about how much cholesterol is in the body. It's really from the liver that we get it. So your brain also needs cholesterol, right? Your brain, the 25% of your brain mass is cholesterol, right? Which is 2% of the total weight of your brain. So your brain needs cholesterol because it has what's called myelin, which are these little fatty sheets that coat the nerve cells. And about a fifth of that is cholesterol. And so without that, we don't get proper neuronal communication, and we start to get cognitive problems, right? So if you want to have a sure way of getting cognitive problems and memory issues, things like that, take a cholesterol lowering drug, all right? Which we'll see later, that is probably one of the biggest side effects of these statin drugs. Okay, we also have nerve transmission gets affected, and lower cholesterol can lead to a reduction in serotonin. Now, serotonin, many of you probably know, is your feel-good hormone, right? So serotonin receptors don't work without cholesterol. And the other thing that cholesterol does that people don't realize is it aids the immune system. It can help get rid of bacterial infections, right? Which, and how it does that is with the good cholesterol, the HDL. So if you do have a low-grade infection and you go to the doctor and you don't realize you have an infection, and he checks your cholesterol and, oh my God, your LDLs are really high. Well, your HDLs may be getting used up because they're fighting a low-grade infection that you don't even realize you have. So when we talk about HDL and LDL, right? Technically, HDL and LDL are not cholesterol, right? HDL stands for high density lipoprotein. So the lipo part is the cholesterol, but it's attached to a protein molecule. So we just, for simplicity's sake, we'll call it cholesterol, but they're technically not cholesterol. Cholesterol is a part of the molecule. So the LDL which is known as the bad one, although you'll see that without LDL, right, it's life doesn't have a meaning to it, has two different subtypes. You have subtype A and subtype B. And as a norm, when they check cholesterol levels, they don't check your subtypes. Because if you have subtype A, that's very cardioprotective and it doesn't harm the body. Subtype B is a smaller molecule, and it's a very dense molecule, and that's the one that damages the vessel walls. And same thing on HDL. You have HDL, you have different types of HDL. We'll go over that in 1 minute. So LDL brings cholesterol to the site. Usually if it's we're talking about cardiovascular disease, LDL will bring cholesterol to the site of damage and then drop off the the cholesterol, and HDL will pick up cholesterol and bring it back to the liver to either get excreted or to get recycled. So as we mentioned before, LDLA is a buoyant, fluffy molecule. It doesn't do any harm. Okay. Now, when we say it doesn't do any harm, right? Cholesterol is not going to harm you at all if it's not oxidized. And what is oxidation? Oxidation is when an electron gets broken loose from the molecule. So now it makes that molecule unstable, and that molecule is looking to find another electron, so it starts to damage other tissues around it. And that LDL B type is very prone to oxidation. Okay. The most important cholesterol particle, which conventional tests do not focus on, is called lipoprotein A. That's a very small, highly inflammatory particle that forms blood clots. Okay. Then you have one other form that's MG-min, low density lipoprotein, which we're not really going to discuss because it's not too much is known about that. But that lipoprotein A, it circulates throughout the blood, and it carries out repair and restoration on damaged blood vessels. But the more repair you need in the arteries, the more lipoprotein A is going to be utilized and concentrate at the damaged sites and bind to any amino acids that are in the cell wall of the blood vessel. And then it's going to drop off the LDL, and it'll do that over and over again, and it'll start to promote deposits of oxidized LDL into the walls, leading to more inflammation. And then what's going to happen is you're going to get a plaque buildup. Now, the lipoprotein A also promotes the formation of blood clots on top of this plaque formation, and that's how we get the narrowing of our blood vessels. Now, if we eat fats, we're going to promote that pattern A of the LDL. And interestingly enough, we eat sugars and carbohydrates, we're going to promote more of the LDL B type, or the bad type. So we're going to see later on how we want to stay away from things like sugar. Okay, so the HDL, the good cholesterol, right? HDL2 is what we're looking at, right? These are particles that are large and buoyant, and they're cardioprotective. HDL3 there's not a whole heck of a lot known about it. There's not a lot of research on it, but they're small, dense, and it's possible they're inflammatory. So what we want is more of our HDL2s and not so much the HDL3s. So if you are going to get a cholesterol test done, it makes no sense to just get a cholesterol test to know what your LDLs, HDLs, and triglycerides are. That tells you nothing, right? Ask your doctor for one of the following tests that'll actually give you a profile of what type of LDLs and HDLs you have. And those tests are, number one is an NMR lipoprofile, okay, which analyzes particle size based on the magnetic properties. You have a lipoprint and the Berkeley test, which uses an electrical field to distinguish the size of the particles. There's something called a VAT test, which separates the protein using a centrifuge. And then finally, a lipoprotein particle profile. Any one of those tests will be able to break down the percentage of LDL-A, LDL-B, and the HDL2s that you're looking for. So how does cholesterol become the bad guy in this story of heart disease? It was The cholesterol hypothesis states that abnormal cholesterol levels will promote the buildup of plaques in arteries, right? And saturated fat runs up cholesterol levels, right? So everybody heard don't eat saturated fats because they're going to increase your cholesterol and lead to heart disease. This was started by a Dr. Ancel Keys, and he based this off of research that was done back in the 1950s, which I'll show you in the next slide, based on feeding rabbits massive amounts of cholesterol. And I'll explain in a minute why that's faulty thinking and shouldn't have been concluded this way. But what he did was he did something called the 7-country study. And this is the cornerstone of where the cholesterol and fat recommendations of our current governments lie. And what he did, he demonstrated supposedly a clear link between the amount of dietary fats one consumed and the incidence of heart disease. The countries, he said, that ate the most amount of fats had the higher risk of heart disease. But the problem with that is, it's although he only used 7 countries, there were 22 countries that actually had viable information and statistics on the consumption of fats. But he cherry-picked the 7 countries that fit his narrative, because later research was done, and they found that when they looked at the data with all 22 countries, the fat ratio of increasing heart disease basically vanished. So this is the study that was done in the British Journal of Hematology back in 1957 that was started all this mess on cholesterol. Again, they fed rabbits massive amounts of cholesterol, and of course the rabbits' arteries clogged up, so they said, therefore cholesterol must be the cause of heart disease. Now, rabbits don't make cholesterol, right? So there's no business for cholesterol being in a rabbit's system like that. We always kind of equate that if cholesterol is cardioprotective because it's healing damage, right? You get little micro tears in your artery walls, and you can send cholesterol in to patch those up. So much the same way, where if you go and see a building on fire, you see a lot of firemen, you wouldn't say the firemen are causing the fire, because every time you see a building on fire, you see firemen. And it's sort of the same thing that cholesterol is doing. Every time you see heart disease, you see cholesterol. Well, cholesterol is there to try and protect you and keep you alive. It's not the cause. It's just the effect. Same way like a fever isn't the cause of your sickness. Your sickness because you have an infection, and the body is just increasing your basal temperature to try and fight that infection. One other thing that we mentioned before about how cholesterol is going to be going to aid in your immune system. And so some theory is that that's part of the reason why cholesterol shows up on these injuries, because you get an infection where we get these little tears, and cholesterol is also there to help try and battle that. So our medical guidelines, and again, I wouldn't put any credence into it, but it's under there just to be thorough. Optimal levels, according to medical guidelines, are cholesterol under 200, and with the LDL under 100, and triglycerides under 150. Okay, they revised that to being under 100 on the triglycerides. 150 is still giving as upper normal limits. Okay, so we mentioned him earlier about Dr. Keys being the founder of this cholesterol crusade. But he's even on record as saying that there's no connection between cholesterol and the foods that we consume having any effect on our blood cholesterol. So he's basing it on how well our body is manufacturing or synthesizing cholesterol. So this was Dr. George Mann. He was one of the original developers of a study called the Framingham heart study. This was probably the largest and longest heart study done even to date. And what they did was they followed the residents of this town called Framingham, Massachusetts, about heart disease. And they found that the cholesterol played very little part in those who got cholesterol and those who didn't. And they even found or I'm sorry, those who got heart disease and those who didn't. And they even found that participants that had a cholesterol as low as 150 still had heart disease. So they really dismissed it as a way of determining who's going to get heart disease. Okay. He described cholesterol as an indicator of heart disease hypothesis as the greatest scam ever perpetrated on the American public. So there's another study, antihypertensive and lipid-lowering treatment to prevent heart attack trial, which was conducted between 1994 and 2002. And this was the largest cholesterol study ever undertaken. And again, same thing we find here. Death rates from heart attacks were examined. There was no difference between control group and the treatment group. And in fact, based on the World Health Organization, this was written, that got this out of a book called the Great Cholesterol Con. This was written by medical doctor Malcolm Kendrick. He analyzed a couple of studies that were conducted by the World Health Organization. And it's Global MONICA project, which stands for Multinational Monitoring of Trends and Determinants of Cardiovascular Disease. And the World Health Organization studied cholesterol levels in populations around the world. And again, what they found was that the higher level of cholesterol, the lower the death rates. So I think we can start to see that cholesterol really got a bad rap and is not really the entire story. Yes, there are some issues with cholesterol, especially the oxidation process, but all in all, cholesterol is more your friend than your enemy. So let's discuss statins, because they are the #1 selling drug in the world right now. And it's based on our topic here. It's very relevant, right? So statins generate more than $30 billion a year in revenue. So we can kind of get an idea of why there might be some motivation to keep selling statins. I mean, if the world knew what statins really did, 30 billion a year would all of a sudden vanish from the revenue of these big pharma companies. Okay, statin drugs have been linked to over 300 side effects. I mean, that's a laundry list of stuff, right? Polyneuropathies, which are nerve issues. Sensational changes, which increase changes of pain, loss of memory, speech, cognitive impairment. Now, if we go back to what we were talking about of what cholesterol does, right? You can see why we can get cognitive impairment, right? Your brain needs cholesterol because those synapses of how the nerves communicate with each other need cholesterol. We'll get joint pain. The most common side effect is muscle pain and muscle damage, called rhabdomyolysis. Okay, this is a life-threatening condition because you'll get death of muscle tissue. Okay, you get fatigue. Okay, we'll tell you why you're going to get fatigue in a minute. Liver damage. Okay, cancer, cataract, sexual dysfunction. Because earlier we talked about how you need cholesterol to make testosterone, estrogen, and progesterone. Right now, you cut off that pathway, you're going to get sexual dysfunction. And then it inhibits CoQ10. Now, CoQ10 is needed for energy, right? CoQ10 is made by something called the HMG-CoA reductase pathway, and that's the same pathway that statins turn off because it's the same pathway that the liver makes cholesterol from. So in addition to cutting off that pathway, it cuts off the coenzyme Q10 pathway. Now, coenzyme Q10, again, we said makes energy, right? So it does a couple other things, which we'll explain in a minute, but it makes energy, right? So your heart is a muscle, and that muscle requires a lot of energy. Your heart is one of the bigger organs that requires coenzyme Q10 to function. So now all of a sudden you take a statin that cuts off the CoQ10 that your body's making, and your heart can't pump as much, right? You're gonna get cardiac failure, right? Because of statins, right? So if you are, and I don't know why anybody would be, but if you are on a statin, or if you know somebody on a statin and they absolutely do not want to get off it, make sure they're taking coenzyme Q10. Hopefully their cardiologist mentioned this to them, but if not, make sure that you get them on CoQ10. All right. So the other things that CoQ10 does that's worth mentioning is it's an antioxidant, right? Antioxidant helps prevent those free radicals that we talked about when the electron's missing, right? Which LDL is very susceptible to free radical damage, or what's called oxidation. So CoQ10 is going to be protective of that. CoQ10 also is responsible for what is it responsible for the cell, making part of the cell membrane. Okay, so it's going to be along with cholesterol, helping get in and out certain nutrients into the cell. Okay, the other thing that happens when you cut off that HMG-CoA reductase pathway is it's gonna block something called nuclear factor kappa B, and this is a protein complex that controls the transcription of DNA. So without that, your body is gonna not make and replicate DNA as well, which everybody knows DNA is the blueprint of what makes you you. Right? So I think we can agree it's not exactly a good idea to cut that off. Okay. The other things that that's going to be inhibited is something called oxytocin. Now, oxytocin is not made from cholesterol, but oxytocin gets into the target cell via receptors that are cholesterol based. Right. Oxytocin is a hormone that provides bonding. Right. We get massive releases of oxytocin after we have sexual intimacy, right? It's how you bond with somebody. So now you're going to cut that off, and so statin's going to leave you a little bit more cold and less feeling. Okay, so this the study that was done, I'm just going to explain a little bit about how data gets manipulated here. The study that was done, called the Jupiter study, which stands for the Justification for the Use of Statins in Primary Prevention. Now, right there, the title alone should tell you that study is already biased, right? You can't name a study that this is what we're going to prove. That's not what studies do. You're supposed to go in with an empty mind and let the data speak for itself. But when the studies are saying this is what we're going to prove, you're going to find a way to prove it. But when they released a study, they said that heart attacks were lowered by 50% by taking Crestor, which is a statin. Now, if you take a closer look at that study, you'll see that 50%, there's something called relative and there's a relative data and true data. So although it was 50% reduced, right? It was reduced from 1.9 down to 0.8% of people who got heart disease. So, it was a 0.8% improvement by taking Crestor for a year and a half. And 0.8 is 50% of 1.9, so that's how they got there. We reduced heart attacks by 50%. But the researchers calculated that this translates into about 120 people needing to take the treatment for almost 2 years in order to just prevent one heart attack, right? Which I think we can agree, it's probably not the best use of your money and time, and especially considering those side effects. The other thing that they failed to mention was that the Crestor group also had a significantly higher increase in cases of diabetes. So you're trading one disease for another. Okay, and then again, we mentioned before, the risk of having a heart attack in the placebo group was 1.8 versus the risk of having a heart attack in the Crestor group, 0.9. So if cholesterol is not the cause of cardiovascular disease, what is, right? And there's going to be 4 culprits that we're going to talk about initially. And one is inflammation. Second one is oxidation, sugar, and then stress. Now, we already touched a little bit about these. We're going to go into just a little bit more detail. Okay, just so you guys know, the beginning part of this lecture is background, and I know it's a little dry. When we get to how we're going to fix it, the second half of this lecture, it'll be much more applicable to your everyday lives. Okay, so just stick with me. Okay, so inflammation, right? Low-grade inflammation is often asymptomatic, which means you don't even know that you have inflammation. It's below the surface, but it's incredibly damaging, right? And it damages your blood vessels most of all. Okay, it leads to chronic diseases such as atherosclerosis, okay, diabetes, cancer, arthritis, multiple sclerosis, irritable bowel syndrome, high blood pressure, and lupus. The best way to test whether you have low-grade inflammation in your body is what's called the C-reactive protein test. CRP is a marker for inflammation that is directly associated with heart and cardiovascular health. So if you get this test done, if you ask your doctor to do a C-reactive protein test, make sure you get a high sensitivity test at HS-CRP, okay? And then optimal levels are below 0.8 milligrams per deciliter. Okay, so other biological characteristics that are associated with high CRP levels would be things like infection, high blood sugar, and let's go now into oxidation. All right, so oxidation, as we mentioned earlier, is when a cell lost an electron. So once your immune system notices that you get damaged, in this case LDL, which is most vulnerable to oxidation, it sends in monocytes. So monocytes go in to try and clean up the mess, right, the damaged cell. And they release something called cytokines. Now, these cytokines will release into the blood vessel, and they'll stick to them with something called adhesion molecules. And that acts like a molecular glue and grabbing onto the monocytes that have rushed to the scene. Okay. Now, if the inflammation isn't halted at this point, you're going to start to develop a fatty streak in the artery. Okay. And these cytokines are essentially chemical messengers that help regulate the immune system. But a lot of these cytokines are very inflammatory. So you have what's called macrophages, which just will kind of eat up and consume the oxidized LDL, okay? And then it's kind of like they'll just eat and eat and eat, and then they kind of almost blow up themselves and form what's called a foam cell. A foam cell, it's just what it sounds like. It turns into kind of like a foamy mess. And then plaque is basically just a big collection of those foam cells. So the body tries to wall this off by building a wall around it with either scarring or calcium or something like that. But then the immune system is going to try and break that down. And so you'll get this back and forth, right? Inflammation, you can get back to the cytokines, and the body can try and break it down. And you'll get this over and over again until either you get a rupture in the arterial wall or you get a blockage. Okay, now sugar. Sugar is extremely damaging for a number of reasons. High sugar intake drives up your hormone insulin, which raises your blood pressure and also increases your cholesterol. Okay, sugar is also processed carbohydrate, raises triglycerides, which we're going to talk about in a moment. Okay, and they're an important independent risk factor of heart disease. When sugar in the bloodstream sticks to proteins, it creates something called advanced glycation end products, or AGEs, which causes you to age a lot faster and is also inflammatory. Okay, the same process also damages LDL and contributes to more inflammation, and insulin increases HMG-CoA reductase production, which we mentioned earlier is the way you get cholesterol, and is also the way you get coenzyme Q10. So insulin can narrow your arterial walls, and insulin also can cause the kidneys to hold on to salt, and then which in turn increased salt will increase water retention, which means you get higher blood volumes, and the more blood volume means higher blood pressure. Okay, so a good indicator whether you're insulin resistant, which means going to be more insulin produced in the body, it's just the cells can't use them, and we're going to get all this damage, is by looking at your waist size. Okay, so men waist size over 40 inches and women's waist size over 35 inches is a good indicator that you might be insulin resistant. If you want to learn more about that next week or next month, we'll be doing diabetes and diving deep into that. Okay. High level of sugar and insulin damage the LDL sub B type, right? Not the A type that's protective, but the B type that's actually more damaging. And it makes them far more likely to start the inflammation process. Now, glycation, which is happens when there's too much sugar hanging around the bloodstream. That excess sugar starts to gum up the works and it inserts itself in the places where it doesn't belong, like the LDL molecule, and you're going to get those advanced glycated end products. Other things that can cause glycation are things like heavy metals. So if you have mercury fillings in your teeth, or if you're using an aluminum-based antiperspirant, something like that, or pollution, these will get into your system, and you probably would have to do something like get them out through something called chelation, right? Heavy metals will stick in your system and cause a whole host of problems. Okay, other things like insecticides, radiation, and toxins from the environment, the foods can all cause these AGEs. Okay, and these chemicals will constrict blood vessels and harm arterial walls. And specifically, they cause your LDLs to become oxidized. Remember, only the oxidized LDLs will stick to arterial walls and cause problems, right? Without oxidation, we don't have a problem. All right. So just a quick note about the difference between sugars, right? Glucose goes right into your bloodstream, and it's very different than fructose. On the market a lot, especially in processed foods, we have high fructose corn syrup, right? Fructose is a big no-no. It's very bad for you. If fructose goes, instead of getting into your bloodstream, it goes to your liver, and fructose almost acts like an alcohol. Okay, research has shown that fructose is 7 times more likely to form these yeast. Okay, it's metabolized by the body like fat, and it turns fat into triglycerides almost immediately. It's also a major cause of accumulation of fatty liver. Okay, it also raises something called uric acid levels, which are primarily in gout. Okay, high uric acid levels, in addition to causing gout, is also a contributor of obesity as well as high blood pressure. Then the last thing on this is stress. So current medical research says that about 95% of all diseases can be linked to stress, right? And the other 5 will be genetic. And let's show you what happens with the stress response. So this is the adaptive stress response. Now you have 2 parts of that, right? You have an immediate stress response, and then you have a maladaptive or prolonged stress response. So everything in the immediate stress response is designed to keep you alive, right? The fight or flight response. It's designed to either get you to fight the threat, the tiger, so to speak, or to run away if you can, right? And increase adrenaline and cortisol, which gets more energy into the system faster. Okay, high levels of glucose, energy mobilization, increased cognitive performance, cardiovascular tone, right? Increased respiration, do cardiopulmonary tone, makes pain tolerance and stress analgesia, which means you don't feel pain. Immune system goes up, right? Blood clotting factor goes up in case you get wounds. Blood pressure goes up to get more energy to the muscles. Skin conductance with sweat so that you're a little more slick, so your predator can't grab you. High muscle tone, high brain activity, GABA production, right? And then your body shuts down non-essentials, right? You don't need digestion, right? You don't need to digest lunch if you're going to be lunch, right? Decreased sexuality, reproductive hormones, growth and healing, because you don't need to heal at this point. Extremity temperature all go down. Now, this is fine for a short period of time to fight an invader. What happens is the brain prepares the body for defense, this fight or flight response, right? Now, cortisol and adrenaline are the 2 main components of this, and these hormones raise blood pressure and prepare the body for the situation. But when we fail to encounter a physical stress, right? These hormones and these chemicals, they all remain in the bloodstream for a long period of time. And as a result, they start to cause a lot of problems because they're looking for something to do, and we're not going to burn them off. So we start to get things like anxiety, dizziness, rapid heartbeats, various things like immune response goes down, right? Our memory goes down, sexual impotence, pain tolerance increases. Pain tolerance decreases, our pain increases. Our skin conductance, we get dry skin. Will increase our insulin resistance, fatigue, stress with hypertension, respiratory problems, infections because our immune system has been compromised. Okay, anhedonia, which means that we just kind of don't feel happy, and depression, bone decalcification, okay, addictions, somatic syndromes, autoimmune disorders, digestive issues, stroke, cardiovascular failure, and renal failure. These are all things because there's just too much of this hormone hanging around. All right, so we talked already about the two main culprits here of cortisol and adrenaline. Okay, so two ways to raise your cortisol level is chronic psychological stress or sleep deprivation, which cortisol, we talked about, increases blood sugar and suppresses the immune system, and it also decreases bone formation, and it affects fat, protein, and carbohydrate metabolism, and can lead to weight gain. It's very pro-inflammatory and produces fat cells around the abdomen, which is why we mentioned that 40 for men, 35 inch for women is going to be a pretty good indicator that a lot of cortisol is being released, a lot of insulin resistance is going to happen at that point. All right. So we talked about way earlier that over-exercise can release pro-inflammatory cortisol. Cortisol from stress stimulates fat and carbohydrate metabolism for fast energy, right? Which then releases insulin. Insulin is going to then cause chronic cortisol release, will cause abdominal fat, okay, inflammation, destruction of immune system, increased aging, increased risk of acne flare-ups, death to brain cells and muscle cells, and increased hunger and increased appetite. So exercise, which is great for the skin because it produces collagen, which is the most abundant protein in the body. Cortisol will break down proteins because it's looking for fast energy. So if we overdo it, we'll actually get the reverse effect that we're looking for. Okay, this was from a book called Beyond Cholesterol. And the author wrote that we know anything that causes the body to pour out stress hormones chronically creates conditions under which heart disease progresses. Okay? That's because stress hormones stimulate the release of inflammatory chemicals by the immune system. An inflammatory reaction is responsible for creating those small plaques and causing them to burst, and may believe the main cause of inflammation is the response of psychological stress by the nervous system. All right, a couple more to go, and then we'll get into the actual practical application of this. So fibrinogen is also an indicator of cardiovascular risk. Fibrinogen is a glycoprotein that's made in the liver, and it's used for blood clotting. Normal levels should be between 400 micrograms per deciliter. There's two tests that you can choose. You can choose a FIF test or the Klaus method. Okay, and then you'll see optimal fibrinogen levels are down there at, that's ferritin, I'm sorry. That should have been on the next slide. I think it's the next slide. So ferritin's being, ferritin is iron, which we're going to discuss in a moment. Here we go. So iron overload, right? Hemochromatosis. It can contribute to heart disease, okay? Because iron is very susceptible to oxidation. And iron levels can build up in the body, okay? So if you're taking an iron supplement, it tends to store in the body and builds up over time. So a good way to help lower your iron levels is either to give blood. And women have menstruation, so that's why they keep their iron levels low, which means they're going to have less blood thickness. Okay, the other thing to note is vitamin C helps the body absorb iron. So if you do have an iron problem, keep your vitamin C levels within limits, okay? Somewhere around 100 milligrams a day. But we're gonna see later how if vitamin C may be a cause of cardiovascular disease. Okay, homocysteine is another indicator of heart disease. So homocysteine is a common amino acid in your blood, and you get it most from eating meats. It's not grass-fed meats, but if you eat grain-fed meats, it has a lot of homocysteine. Contributes to atherosclerosis, reduces flexibility of blood vessels, and helps make platelets stickier. Okay. It also increases oxidation damage and promotes inflammation and thrombosis, okay, which are blood clots. Okay, there's a direct cause between homocysteine levels and increased risk of heart disease and stroke. So luckily, it's very easy to bring down homocysteine levels. It's all you need are three key vitamins, and those are your Bs, B6, B9, and B12. And I gave you the recommended daily allowance there, 400 to 800 micrograms of folic acid, 4 to 1,000 micrograms of B12, and then 5 to 20 milligrams of B6. So I'm going to put that all together, and these are your basic tests to see exactly where your cardiac profile is. All right, we're going to discuss the first one in a minute, but that LDL particle size, C-reactive protein, fibrinogen, serum ferritin, which is iron levels, lipoprotein L, homocysteine, interleukin 6, which is another pro-inflammatory cytokine. And then the last one is the coronary calcium scan. Because remember we mentioned that the plaques are made of not just cholesterol, but also calcium. So you can do a carotid artery calcium scan to see how much calcium has been deposited. And remember, cholesterol only makes up about 3% of the arterial plaque, and the calcium is about 50%. So it's a much better test to measure how well your arteries are doing. Okay, let's get into some nutrition now, all right? So we're gonna first discuss macronutrition, carbs, fats, proteins, and then we'll get into some supplements and then talk about some other things. All right, so our good carbohydrates, right? They are fruits, vegetables, and we're gonna see why beans and legumes are especially cardioprotective. Our bad carbohydrates are basically anything in a box, anything that's got a barcode on it, anything that has a long shelf life, right? Cereals, white rice, pastas, breads, cookies, pastas, snacks, sodas, juice, crackers. So the best source for reversing arteriosclerosis, as I just mentioned a moment ago, is beans. Right? The reason why is because they have high fiber. Okay, so it's this high fiber is what it's going to do is it's going to grab onto the bile and it's going to help remove it through the intestinal tract. Remember, we said that one of the things cholesterol does is it makes bile for emulsifying fats or digesting fats. Now, if you have high fiber, and it's not all fiber is not created equal, beans tend to be the best. Oatmeal can do a decent job, but beans tend to be the best at helping remove the excess bile. And because if you don't remove the bile, what happens is the cholesterol portion gets recycled back to the liver. So beans would be an excellent way to help get that number down. And bad carbohydrates, which cover almost all the carbohydrates that are on that right side and everything that's manufactured, are gonna increase inflammation. Now, the exceptions we mentioned already, oatmeal and also Ezekiel bread, because Ezekiel bread is a sprouted bread and it doesn't have the same preservatives that these other breads have. Okay. So the Nurses' Health study that we mentioned way earlier, they found that refined carbohydrates and high glycemic loads were independently shown to be associated with increased risk for coronary heart disease. Okay. The glycemic load is how much your blood sugar gets raised in a period of time. So, foods that spike your blood sugar are much more damaging to your blood vessels. Okay, American Journal of Clinical Nutrition found that replacing saturated fats with high glycemic index, which is what happens when we have fat-free foods. If we go to the supermarket, you see fat-free this, fat-free that. They replace it with high glycemic loads, either of fructose or something else. They're associated with 33% increased risk in heart attacks. And this was done in the American Journal of Clinical Nutrition. Okay, intake of carbohydrates compared with intake of saturated fatty acids and risk of myocardial infarction. That was the name of the study. The amount of saturated fats actually lessens the anti-inflammatory action of HDL. So cholesterol, it's not, I'm sorry. Larger amounts of saturated fat can lessen the anti-inflammatory action of HDL. Okay, it's far better to reduce dietary carbohydrates. So when we look at fats, we have three main categories. We have saturated fats, and then unsaturated fats are broken down to monounsaturated and polyunsaturated. Now, saturated fats get a bad rap, and we're going to discuss those in a little bit. And we're going to see why some of the actual vegetable oils that are polyunsaturated are actually bad for you. So let's discuss saturated fats, which come mostly from our animal fats, but also from things like coconut oil and palm oil. Now, these fats raise the good cholesterol, the HDL, the one that's less likely to get oxidized. And it changes the pattern of your bad cholesterol into a more favorable pattern A, as opposed to that small, dense pattern B. Saturated fats tend to be solid at room temperature. They're also very high heat resistant, okay, which is very good when you're cooking. The thing with the polyunsaturated fats is they get oxidized very easy with heat, which then causes things like cancer. Okay, and there's been several recent studies that have shown that saturated fat is not associated with greater risk of heart disease. One was conducted by Harvard. It concluded that greater saturated fat intake is associated with less progression of coronary atherosclerosis, where carbohydrate intake is associated with a greater progression. And that Nurses' Health study that we did earlier, refined carbohydrates were independently shown to be associated with increased risk of coronary heart disease. Okay. And as a meta-analysis of another study, 21 studies were looked at, and what they found, they looked at 347,000 participants, and they followed in between 5 to 23 years. In that time period, 11,000 of the subjects developed coronary heart disease. Okay. Intake of saturated fat was not associated with an increased risk of coronary heart disease or stroke, nor was it associated with an increased risk of cardiovascular disease. Those folks consuming the highest amount of saturated fats were statistically identical to those consuming the least amount when it came to the probability of coronary heart disease, stroke, or cardiovascular disease. And which is basically what we just said. Okay, so dietary intake of saturated fats is associated with a modest increase in serum total cholesterol, but not associated with cardiovascular disease. All right, and there's another study basically saying the same thing. Okay, in postmenopausal women with relatively low total fat intake, the greater saturated fat intake is associated with less progression of coronary atherosclerosis, whereas carbohydrate intake is associated with a greater progression. So our unsaturated fats, we have a couple subcategories. One is our omega-3s and the others are our omega-6s. Omega-3s primarily found in fish like salmon and other cold water fish, also in grass-fed beef, not grain-fed beef, but grass-fed beef. And there are three types of those. We mentioned them earlier: alpha-linolenic acid, EPA, and DHA. Okay, and then omega-6, which are found in our vegetable oils, right? And those are very inflammatory. Your ideal ratio should be around 1:1. Can be as high as 4:1 for 4 omega-6s to 1 omega-3. The omega-6 are the precursors to the inflammatory hormones called arachidonic acid. Linoleic acid has been shown to increase the oxidation of LDL. Linoleic acid is an omega-6 that's in the vegetable oils. So it causes oxidation, which causes damage, which then causes increase in heart disease. Okay. Increase in severity of coronary atherosclerosis, and in omega-3s as building blocks for the anti-inflammatory compounds. These are the prostaglandin 1 and 3. So the only one that's essential in your diet is alpha-linolenic acid, because your body can make EPA and DHA. Now, it can make them, but it can't make them in great enough quantities to be cardioprotective. You really should be supplementing with EPA and DHA up to 3,000 milligrams a day. And you should be also trying to eat salmon at least 3 or 4 times a week. All right, let's move on. So a much better indicator than simply measuring your cholesterol is looking at your ratio of triglycerides to HDL. So if you calculate your ratio of triglycerides to HDL, what you want to find is a ratio of 2 is desirable. Okay, anything higher than that, and it's an indication that you might be damaging your arteries. Okay, so we have on the foods that are recommended for cardioprotection, right? Wild salmon, berries, and cherries are powerful antioxidants. Grass-fed meats for the omega-3s. Vegetables, nuts, beans for their fiber, dark chocolate because it has flavonoids, garlic and turmeric, both anti-inflammatory, pomegranate juice, green tea, and red wine. Red wine has resveratrol in it. Green tea has EGCG. I'm not exactly sure what pomegranate has. Extra virgin olive oil, okay, but should not heat extra virgin olive oil because it can break down in heat. And then also you want to make some lifestyle changes, right? You lower your stress levels. I think we mentioned earlier about how bad stress is, okay? Express your emotions, play, okay? Also intimacy and pleasure, and enjoy your life. All right. So foods to eliminate are grain-fed meats, sugars, soda, processed carbs, trans fats, processed meats, put it down twice, my bad. Vegetable oils, okay, corn oil, canola oil, soybean oil, stay away from those things. Fast foods, big no-no, right? Not even once a week, because it takes a good 36 days for trans fat to break down. So even a once a month, something you ate a month ago, those trans fats are still in your body causing havoc. Non-dairy creamers, another big problem, okay? And then margarines, cakes, ramen noodles, soup cups, and all packaged baked goods. So let's talk about vitamins real quick. Okay, I know it's getting a little bit past our time, but hopefully you guys will stick with me. So here's the biggest secret here we got. Okay, this is based off of a Canadian physician back in 1953, and he found that atherosclerosis, sclerotic plaques, form over vitamin C starved vascular tissue in guinea pigs and human beings. Now, most other animals make their own vitamin C, which is why you don't see heart disease in other animals besides human beings. And then along came a man named Linus Pauling, who is one of the only people who won 2 separate Nobel Prizes in 2 different categories. I think one for chemistry, and I forgot the other one was in. And he, along with his partner, observed a link between cardiovascular disease and vitamin C based on the earlier work. They described it, what's called the unified theory of human cardiovascular disease. And basically, the human body exactly regulates blood concentration of cholesterol. So that wasn't it. It offered a compelling argument that with proper nutrition, not drugs, right, cardiovascular disease can be prevented and even reversed, and cure the power of vitamin C to strengthen blood vessels through the body. So they recommend taking anywhere from 3,000 to 15,000 milligrams a day. So you would start, if you're taking vitamin C, you're going to start 3 times a day, right? Because your vitamin C stores only about 6 hours. Okay, so 6, 12, 18 hours, and then you need sleep time. And you're going to take vitamin C to tolerance level. You'll notice that when you have too much vitamin C, you'll start to get diarrhea. So that's where you would back off a little bit, but you would slowly increase your vitamin C dose, okay, anywhere from 3 to 15,000 milligrams a day until you start getting diarrhea, and then you slowly back off. Okay, so the root cause of coronary artery disease, Linus Pauling determined, was artery weakness, and that weakness can weakened condition. Coronary arteries yield a high pressure and constant pounding pulse from blood pressure, which then would develop cracks. And then a large 2011 study published in the American Heart Journal found that lowering levels of vitamin C in the blood, the higher the risk of heart failure. Now, collagen is most abundant protein, as we mentioned earlier, and it forms into fibers, which are strong, and when compared to iron, they're stronger than iron. These fibers provide strength and stability to all your body tissues, including your arteries. And collagen formation requires large amounts of vitamin C. So these collagen fibers are made from 3 different strands. One is vitamin C, and then, one is made from L-glycine molecule, a strand of proline and lysine, and needs vitamin C to make it. Okay, so L-glycine, the body can make. Okay, the other two, which is L-lysine and L-proline, you need to supplement. So 3,000 milligrams of each a day in 3 equal doses. Okay, you take L-lysine, L-proline, and vitamin C to ensure adequate collagen repair. So not only is it going to be cardioprotective, but also it'll help remove that lipoprotein A that we said is so damaging. Okay, in addition to this, L-arginine is an accompaniment to that, which would be 500 milligram tablets in the morning for heart health. Okay. Other helpful items to enhance vascular tissue and strengthen collagen repair, the things we already talked about, which is coenzyme Q10, okay, and something called hyaluronic acid. All right, so coenzyme Q10, okay, we've already discussed it. It's also known as ubiquinol, okay, how it's responsible for making energy, and the heart needs energy to function. So it says energy production. It works with L-carnitine. So we want to supplement with L-carnitine as well as CoQ10. Has a greater ability to lose body fat with CoQ10 because it's an energy producer. Regulates blood sugar and insulin sensitivity. So we talked about how insulin is damaging to your blood vessels, and protects your cardiovascular system. Now you need 3 weeks worth in order for it to adequately build up in your system. So how much do we need? About 100 milligrams twice a day. Okay. CoQ10 also has the ability to reduce blood pressure, and it's a powerful antioxidant. So it's going to inhibit oxidation damage of the LDL cholesterol and help prevent cholesterol from becoming a problem in the first place. Then acetyl L-carnitine, which we just mentioned, can pass the blood-brain barrier, and it's also going to help prevent glycation with those advanced glycated end products we talked about. It's going to prevent conversion of arachidonic acid, which was that omega-6 we talked about, was pro-inflammatory. It's neuroprotective, improves mitochondrial function, anti-inflammatory, protects cell plasma membrane, and improves sensitivity to insulin. And thing is, we don't want to use this for people that have seizures or depression. It has a negative effect. But L-carnitine studies showed that after a heart attack, it increases the survival rate and makes it less likely you're going to suffer a second heart attack. And recommended dose is going to be 500 to 1,500 milligrams a day. I'm going to also want to add omega-3 with that. So we got coenzyme Q10, we got L-carnitine and omega-3, and then here there are omega-3. 3,000 milligrams per day, up to 9,000 milligrams if you want to lose weight. This was from an article or slide from my last talk a couple months ago, because omega-3 will also help you lose weight. Now we mentioned there are 3 different omega-3s, EPA and DHA, and fish oil. They help the receptor sites of the cell become more sensitive to insulin. Okay? They also decrease cardiovascular risk, reduce inflammation. Now again, these take 3 weeks to build up in your system as well. They stabilize blood sugar, they start with carbohydrate high and lows, increase your immune system, weight loss accelerator, they lower insulin levels, lower the death rate from heart disease, lower triglyceride levels, resting heart rate and blood pressure. They also are mood stabilizers and help serotonin levels, improve attention span, energy level, reduce rheumatoid arthritis symptoms, decrease appetite, and they're very good for skin, hair, and nails. And they increase thermogenesis, or burning of calories through heat. Okay, so astaxanthin is another antioxidant that's found in salmon. Okay, just briefly, it's if you eat salmon, you're going to get this astaxanthin, which is an addition and going to help and be cardioprotective. Okay, niacin, which is vitamin B3. Okay, it's going to lower both triglycerides by 20 to 50% and LDL cholesterol by 10 to 25%. It also reduces toxic substance called lipoprotein A that we've been mentioning. Okay, and it's going to raise the HDL. Okay, if you're diabetic or have a liver ailment, make sure you check with your doctor because niacin could be a little problematic. You don't want a time release niacin, so you take it after meals, 500 milligrams to 3 grams a day. So there's 2 forms of niacin. The other one is nicotinamide, and nicotinamide will not be as cardioprotective as niacin form. Okay, so make sure you take the niacin form. Okay, magnesium is a muscle, is going to be a relaxer of arterial walls. Magnesium, calcium, you want to take them together. Reduces blood pressure, makes it easier for our heart to pump blood and for the blood to flow freely. Okay, it's not recommended for anyone with renal problems, kidney damage, because they can't handle filtering it. And then, so if you do have blood clots, nanokinase is one of the things that was developed in Japan, and it degrades the blood clots, and it also increases your body's own enzymatic ability to break down blood clots. Human trials indicate that nanokinase consumption has been shown to increase total fibrinolytic action significantly and decrease the time needed to complete the clot dissolving cycle by about half. Okay, pantothenic gas, which is B5, produces positive changes in triglycerides and LDL cholesterol. It also increases HDL. And then other supplements that just are worthy to mention are curcumin, which is found in turmeric, which has antiviral, antibacterial properties, also anti-inflammatory. Resveratrol, which we mentioned earlier, found in wine, and then cacao flavor, which is found in dark chocolate, not your milk chocolate. And then vitamin E in a form of mixed tocopherols. You don't want to get alpha tocopherol, you want to get mixed tocopherols because there are different forms of vitamin E. And then, right, we don't really need to go into too much detail, but a brisk walk about 30 minutes a day is going to drastically increase your heart health. Okay, you don't need to go crazy with exercise, just 30-minute walk a day, and it's going to have an immense amount of cardioprotective activities, right? This is a laundry list of stuff that, that exercise helps with, everything from cholesterol to reduce hospital admissions, to reduce strokes, right? It's just, I mean, it's been beat to death in so many different ways that we're not going to go into detail on it because I'm way over my time. But I'm going to have this on recording, so you could always pause it and look at it if you wanted to. All right. So there's that on exercise. Right? And finally, right, we're at the end. We're going to talk about the vagus nerve. The vagus nerve is the largest nerve in the body for, it's called vagus nerve because vagus means wandering. And it can help with reduced heart rate and blood pressure and changes in function of certain parts of the brain. right? It stimulates digestion, and it basically goes to almost every organ in your body. How do we stimulate the vagus nerve, right? There's different ways you can stimulate the vagus nerve. One is through chiropractic adjustment, which is what I do. Also, cold shower, right? A cold shower will stimulate the vagus nerve. Deep, slow breathing will do it. Singing or humming, because part of the vagus nerve goes to the back of the throat, or chanting, gargling, taking probiotics, meditation, omega-3 fatty acids, exercise, massage, and socializing and laughing will all improve your vagus nerve. Yeah. I want to say this, right? I go over stuff sometimes too quick because I realize that I'm way over my hour that I said I would take in this time. So I usually will start putting a lot of stuff either that I wanted to go in more detail in, or stuff that I didn't cover during this lecture on my social media. So if you're not following me, join my Facebook page. And so usually Facebook and YouTube are the two places that I will put for probably the next 2 weeks, just tidbits on stuff that either I didn't cover, or I felt I was getting a little rushed and I wanted to go into a little more detail. Also, especially on both of those platforms, we'll add some other recipes that are also cardioprotective and things you can do to help lower your risk for heart disease. All right. So I apologize if I ran too fast at the end, but like I said, I'm already 20 minutes over. This is just an immense amount of information to cover in such a short amount of time, which is why everything that I didn't cover here will be on my social media page. In addition, I'm going to post this lecture on YouTube for anybody that wants it. And I'll say again, if anybody wants another topic, just drop me a note and tell me what you're interested in. I'll see if I can put together a talk for it. And that'll do. All right. So I hope you guys enjoyed it, and I hope you guys got some value out of it. And I will see, hopefully, some of you on the lecture next month on diabetes. All right. Thanks for sticking around.